Not every EDS or HSD patient is going to present the same because these conditions are on a spectrum after all, but here are some of the things that we commonly see as dietitians in these patients. Gastroparesis or gut dysmotility, malabsorption issues, which can actually lead to malnutrition or nutrient deficiencies, chronic acid reflux that can also bring about symptoms of nausea and vomiting, gut dysbiosis and mast cell activation syndrome, and of course things like constipation, diarrhea, and abdominal pain. So of course the approach in managing these things is unique to the person. Some things that can be done are analyzing blood work to determine if there are any specific nutrient deficiencies and doing targeted supplementation for those. Symptom tracking, and sometimes that can include food tracking too, just to see if there's any type of connection. We can play around with meal portions and meal timing. Sometimes doing an elimination diet can help, or maybe just changing up some of the foods that are actually being consumed. Again, these approaches are going to be highly dependent on the person, but definitely want to kind of explain a little bit of what I do in my practice and some of the approaches that I take to individuals that are managing these conditions. And while I can only really help nutritionally, my support doesn't end there because I do provide patient advocacy and referrals. So this can include actually preparing for appointments and knowing what questions to ask and what specific things to bring up if you're hoping to get a diagnosis or if you've already been diagnosed. I hope this helps, and let me know if you want to book a session.